Kaili because it's 1 o'clock. So welcome everybody to today's presentation. We have Kaili Clark. She's a Canadore student for the mental and health addiction. She's going to do a presentation about amyotrophic lateral sclerosis, also known as ALS. So thank you for doing this presentation, Kaili, and I hope everybody enjoys. Thank you.
Thank you, Francine. So, hello, everyone. I hope that everybody is having a good day today and staying warm because it's pretty cold out there. So, I just wanted to, before we get started, share a little story with you. This lady in the gray right here, that is my Aunt Brenda. About 1.5 to 2 years ago, she started to experience strange and painful symptoms that were undiagnosable by doctors. So we originally believed that she had suffered from a stroke as she began to lose mobility. She suffered from a lot of weakness in her limbs. So she began doing some research of her own. She soon suspected that she had ALS. Oops, sorry, we have a visitor. So she soon suspected that she had ALS, and this was confirmed by neurologists in Huntsville. So she soon developed trouble with swallowing. She often choked on her food when she ate, and at this time she had very little mobility. She was in a wheelchair. She experienced a lot of paralysis in her legs and in her arms. And at this time, she decided that she would do an assisted death when it became too severe for her to handle. So she chose a date, and a few months prior to this date, she checked herself into the hospital. At the hospital, they provided her with a service, and she said that the staff were really wonderful to her during her entire stay. So they explained to her that they were going to use an anesthetic and ketamine to stop her heart, and that she could choose to back out of the procedure at any point up until she lost consciousness, so she never felt forced into it. So her decision to do an assisted death actually resulted in 20 people 20 of her body parts being donated to those in need. As well as her brain was donated for further research to a university in Southern Ontario in hopes of getting a better understanding of this disease. So now you might actually be wondering, what is amyotrophic lateral sclerosis? So it's also commonly known as Lou Gehrig's disease, and it's a terminal idiopathic degenerative disease. So that means that it seems to come about spontaneously and the cause of it is unknown. So it affects the upper and lower nerve cells that are located within the brain and spinal cord, and these are responsible for motor function. It also belongs to a group of broader degenerative disorders that are known as motor neuron diseases. And the death of ALS patients primarily comes as a result of respiratory failure. This is due to the degeneration of the bulbar, cortical, and medullary motor neurons. And these are the motor neurons that are in charge of things like walking, talking, chewing, all of those involuntary muscle movements. So when these motor neurons degenerate and they're no longer able to send messages properly to the muscles, these muscles begin to weaken and eventually waste away. So there are medical interventions that can aid in improving the quality of life for these patients by controlling these symptoms and preventing unnecessary complications. Though at this time, there's currently no cure for ALS. So this is just an image right here, just a little diagram that shows the motor neurons located in the spinal cord. And this is an example of, right here, a healthy muscle and a normal nerve cell. And this is a nerve cell that's been affected by ALS. As you can see, it's been weakened and the muscle has started to waste away. That's why it's much smaller than this one. So typically an ALS diagnosis is made based on a detailed history of symptoms, as well as a series of tests that are used to rule out other diseases that mimic these symptoms. So muscle imaging tests such as electromyographies, nerve conduction studies, and magnetic resonance imaging are often used to help diagnose ALS. So electromyography is a type of test used to measure electrical activity when muscles are being stimulated, as well as when they're at rest, using small needles that are inserted into the muscle that detect any electrical activity and detect any abnormalities. So a nerve conduction study is a type of test that's usually done in conjunction with an EMG, and it's a 3D image of the brain, the spinal cord, those types of things. And these scans typically produce normal results in ALS patients. However, they do reveal other issues and diseases that share similar symptoms. So ALS is incessantly progressive, with 50% of individuals affected passing away within 2.5 years of symptom onset, and only 20% of individuals living between 5 and 10 years after the onset of these symptoms. The onset of ALS tends to affect one group of muscles first before spreading to other parts of the body, and is commonly recognized by 3 patterns of onset. These are respiratory onset, limb onset, and bulbar onset. The most common of these is limb onset, and it's characterized by distal weakness, frequent tripping and stumbling, foot drop, and the wasting of muscles in the lower and upper limbs. So bulbar onset affects approximately 20% of individuals diagnosed with ALS and is characterized by impaired tongue movement. This results in slurred speech, dysphagia, atrophy, and fasciculation of the tongue. The least commonly occurring is respiratory onset, and this can present itself in a number of ways, including dyspnea, orthopnea, and hypoventilation. These also result in an increased carbon dioxide in the blood. So there are 3 different stages of disease progression in ALS. The first one being the early stages. So the rate of progression in the patterns of symptoms varies from one individual to the next, and some may experience symptoms that others do not. This being said, paralysis and muscle weakness and degeneration are experienced universally by ALS patients. So the early stages are typically characterized by muscle atrophy, cramping, fasciculation, and weakness. During these stages, these symptoms might only affect one area, or they might spread to areas, they may mildly affect multiple areas of the body. So it's common for individuals in this stage to experience fatigue, loss of balance, and slurred speech, as well as difficulties completing daily tasks. So say buttoning up a shirt, for example. These early stages of ALS, often also occur before the actual diagnosis is made. The next stage is the middle stage. So during the middle stage, atrophy of the muscles becomes much more severe. And now at this stage, multiple muscles are affected. So some of these muscles might be paralyzed, while others might just be severely weakened. This is when people often begin to develop dysphagia and difficulties with chewing, talking, and even breathing. Some individuals also experience what is known as the pseudobulbar effect. And this is a condition that's associated with various neurological diseases, such as amyotrophic lateral sclerosis, and is characterized by uncontrollable and inappropriate bouts of laughter or crying. PBA can have a significant impact on the individual's quality of life and self-esteem, as these uncontrollable bouts of laughter and crying can be very embarrassing for the patient, also possibly for their friends and family members. And it can also lead to limited social interaction and depression. Say, for example, somebody who is suffering from the pseudobulbar effect is at a funeral and they experience an inappropriate bout of laughter. That's obviously going to be very, very distressing for that individual. So the final stage is the late stage, and by this time, the majority of voluntary muscles have become paralyzed. The muscles in charge of respiration are greatly compromised, and assistance is required for most basic tasks. As I mentioned before, most ALS fatalities come as a result of respiratory failure, but some other less common causes of death in ALS patients are pulmonary embolisms, malnutrition, pneumonia from foods and liquids entering into the lungs, and heart arrhythmias. So a large number of ALS patients don't actually experience any severe loss of their cognitive functioning, which means that they're aware of their progressive loss of voluntary motor skills. So it can be very devastating on an individual to watch, their body be affected in that way. Approximately 1/3 of these individuals in the late stages of ALS, though, are also diagnosed with what is called frontotemporal dementia. And that is because frontotemporal dementia comes as a result of nerve damage in the frontal and temporal lobes within the brain. And this dementia causes drastic changes in behavior and personality, and it can also cause issues with language comprehension, which can lead to further difficulties for those living with ALS. So receiving an ALS diagnosis is extremely distressing for the patient and their family members, and as a result, it should be handled extremely sensitively by the healthcare practitioner. An inappropriately delivered diagnosis can have permanent, long-lasting effects on the patient and their family. For this reason, a healthcare practitioner should approach the task of giving a patient and their family an ALS diagnosis using the SPIKES protocol for breaking bad news. So the SPIKES protocol for breaking bad news is a recommended guideline used for breaking bad news to patients with chronic and terminal illnesses. It includes 6 steps, and the 6 steps are as follows. So the first one is setting up the interview, assessing the patient's perception, obtaining the patient's invitation, providing the patient with knowledge and information, and responding to the patient's emotions using empathy, and also strategy and summary. So this next slide is just a little bit more in-depth explanation of the 6 steps. So when you're setting up the interview, you want to make sure that it's private and that there's no interruptions, and you want to connect with the patient on more of a personal level. You also want to assess the patient's understanding of what they're being told during the diagnosis. So you want to ask like open-ended questions. And you would also want to ask them, how would they like to find out about all this? Would pamphlets be useful? A diagram, that sort of thing. You also want to make sure that you're explaining it in a clear way so that they can, properly comprehend the news that they're receiving, and acknowledge their emotions as they arise. Make sure that you're empathetic and try to set up a treatment plan with them, and then reinforce this plan and summarize the main parts of the consultation. So, sorry, I may have missed a slide. Oh, okay. So, coming to terms with an ALS diagnosis can be extremely difficult. Research shows that there's an increased risk of depression in patients both the year before a diagnosis as well as the year following. The symptoms of ALS can cause patients to withdraw and socially isolate themselves. So it's not uncommon for them to develop mental health issues such as depression and anxiety. The exact reason as to why there's a higher risk of depression in those with ALS over the general population has not been confirmed completely, but there are multiple explanations. Some researchers believe that depression comes as a result of receiving a devastating diagnosis, and living with the painful symptoms that are characteristic of ALS, where other researchers suggest that it might actually be an early indication of degeneration of the frontal lobe. However, it has been noted that those diagnosed with ALS who are 65 years and older are at a higher risk for depression than younger patients. So it's of utmost importance to let those with ALS know that they're not alone. Sorry, I'm all backwards. So it's important to treat these symptoms as they can result in a more rapid decline in the patient's overall health if they're left untreated. Things like psychotherapy and counseling for both the individual and their loved ones can help with this, as well as antidepressant and anti-anxiety medications. However, it should be noted that these medications should only be used in conjunction with therapy, as just using antidepressant and anti-anxiety medications alone can actually make depressive symptoms worse, and it can increase the risk for suicide. So with proper treatment and the support of friends and family, it is possible to help maintain the best quality of life for these individuals under their circumstances. It's of utmost importance to let those with ALS know they're not alone, and individuals can choose to acknowledge only negative aspects of their situation, or they can choose a more positive outlook. So it's important to remind these patients that there is opportunity for them to create new friendships with those who are sharing similar experiences, develop stronger relationships with loved ones, appreciate things that they might have previously taken for granted, become more spiritually aware, and so on and so forth. So it has been demonstrated that incorporating religion and spirituality into the treatment of ALS can help to improve the quality of life for patients through activities that promote positivity, creativity, and self-actualization. For example, doing things like creating a collage or a scrapbook or a memory box with your loved ones can be a really uplifting activity, and it also holds sentimental value. So not only is an ALS diagnosis devastating for the individual receiving the diagnosis, but also for those who are close to them, such as their friends and family and colleagues. So it's important for the patient to maintain an open dialogue with these individuals so that they can discuss their thoughts and feelings throughout the course of the disease. It's also important for caregivers to remember that even though you might want to put all of your time and effort into helping the individual with ALS, it's equally as important to take time for yourself and have lives outside of being a caregiver. So as a caregiver, giving yourself time to process and recover from these daily stresses at work can reduce the risk of compassion fatigue and burnout. It's also important for caregivers to remember that they shouldn't feel guilty for experiencing any negative feelings of annoyance, loneliness, jealousy, feelings of being overwhelmed, because these are all normal feelings, and it's extremely difficult to assist those with a terminal illness, and it can take a very large toll on people's mental health if they aren't finding proper coping strategies to deal with this stress. So compassion fatigue and burnout are characterized by physical and mental exhaustion and a reduced ability to be empathetic. This is often experienced by those who work with the terminally ill or traumatized persons. So some strategies for preventing compassion fatigue and burnout are becoming knowledgeable on the signs and symptoms so that you can address it early on, as well as participating in good self-care practices. So eating a balanced diet, regular exercise, go for a hike, getting adequate sleep, and also addressing your emotional needs. It's also important to create emotional boundaries to prevent becoming overly involved and overwhelmed. as well as maintaining a good work-life balance. So spending time with friends outside of the workplace and with those who are not, or engaging in conversations that are not related to trauma or terminal illness. Even doing things like using a journal to record your personal thoughts and feelings rather than keeping them locked up inside can be really beneficial, as well as avoiding negative coping strategies such as alcohol and substances that would only perpetuate the problem. And also you can seek counseling and therapy so that you're able to express your thoughts and feelings with someone who has an unbiased opinion. So in 1995, the Food and Drug Administration approved the use of a medication called Riluzole, and this is used to help treat patients by hindering the speed at which the disease progresses. So Riluzole is an anti-excitotoxic medication, and it's used to inhibit the release of a neurotransmitter called glutamate. Glutamate is essential for proper brain function. However, when abnormalities in the levels of glutamate in the brain occur, nerve cell health is compromised and communication between nerve cells can be disrupted. So through the use of numerous clinical trials, Riluzole has been proven to extend the survival of ALS patients by 2 to 3 months and is currently the only medication identified by the FDA to be beneficial for prolonging the lifespan of patients with ALS. So non-invasive positive pressure ventilation, also known as NPPV, has been widely recommended for ALS patients who are experiencing chronic respiratory failure. This is because NPPV is a facial mask or a mouthpiece that delivers pressurized gas into the airway rather than an invasive tube that is inserted into the windpipe like more traditional ventilators. So the NPPV has been proven to reduce dyspnea and hypoventilation, which can potentially extend the lifespan of those affected by ALS. The early stages of dysphagia can be managed by speech therapists and dietitians who can help patients to sit in the proper positions when eating and change from regular or problem foods to liquid foods like thick purees and smoothies, that sort of thing. So as the disease progresses and chewing becomes more difficult, malnutrition may occur in these patients. And in order to address this issue, patients are offered the option of enteral feeding. So enteral feeding refers to the method of delivering nutrients directly into a patient's gastrointestinal tract. There are 3 different methods of use for this. The first being a percutaneous radiological insertion of gastromy, which is a tube that passes into the stomach using an X-ray guidance, as well as a percutaneous endoscopic gastromy, which is a tube that passes directly through the abdominal wall into the gastrointestinal tract. And finally, a nasogastric tube. So that is a tube that enters the gastrointestinal tract using the nasal passage. Here is just right here. So this is just a quick diagram of the abdominal wall. As you can see, the PEG is going into the gastrointestinal tract. This one is going through the nasal passage. And this is an X-ray example of a RIG, so a radiological insertion of gastromy. So it's common for patients to find that the many appointments with various healthcare practitioners are overwhelming. So to address this and improve the patient's quality of life, many treatment centers offer what is called a multidisciplinary team approach. So a multidisciplinary team is a group of healthcare practitioners that work in conjunction with one another to provide proper treatment. These teams often include neurologists, psychotherapists, occupational therapists, social workers, palliative care specialists, and so on. So it's been proven that the use of a multidisciplinary team approach can help to improve social functioning, mental health, and the overall quality of life for patients with ALS. So for individuals who live in urban populations, treatment for ALS, for the most part, is readily accessible. Considering that, you know, hospitals and treatment centers are generally only a short drive away. However, for those who reside in rural areas, it can be extremely difficult for patients to have constant access to proper treatment, and there are often barriers that prevent them from accessing these treatments. So for some, traveling a long distance to a hospital or treatment center can be very burdensome and costly. And therefore, they would require treatment in their own home. However, in order for individuals to get treatment safely in their own home, they require proper equipment. So hospital beds, wheelchairs, lifts, ramps, that sort of thing. And these, of course, as you can imagine, can be extremely costly to rent, install, and maintain. So currently in Ontario, the Local Health Integration Network provides this equipment to low-income people in their home for 30 days at a time. However, this is only temporarily helpful. But the ALS Society of Canada has an equipment program that provides long-term access to essential assistive equipment through loans and funding programs. So it provides one piece of each required equipment per individual who is sick. So this is extremely beneficial for those living in rural areas and don't have immediate access to healthcare treatments. And providing these individuals with the tools to live safely at home can, in some cases, mean the difference between serious injury or even life and death. So it's very important that we make these assistive equipment accessible for these patients. So there are many barriers, that those living with ALS in rural populations often encounter. So that might be inadequate finances, lack of transportation. They may not be able to communicate easily with healthcare practitioners if they experience literacy issues or if they speak a different language that's not English or French. They might have concerns about confidentiality that might make them hesitant on accessing these services, as well as stigmatization that's associated with living in rural communities, especially those that Indigenous people face. These are all very real barriers that some people actually choose to forego treatment entirely because of this, which can actually increase the speed in which their health declines. So it's important to remember that while amyotrophic lateral sclerosis might change your physical body, it doesn't change who you are on the inside. You will always be your unique self. It doesn't take away from your soul. And although there's currently no cure for ALS, there are many things that people can do to ensure that patients have the best quality of life during their journey through treatment. So there are things that you can do to help individuals in Ontario with ALS, and that is by accessing the ALS Society of Canada's website at www.als.ca and clicking on the Ways to Give button at the top of the page. They're a registered charity that is funded solely by the generosity of those who donate, and your donation will go towards further research in helping to provide families in Ontario with home visits, support groups, and essential equipment. So that is something to take into consideration. So thank you guys very much for listening to me today. I don't know if there's any questions or what I'm supposed to do here, but I'll give it back to you, Francine.
Thank you so much, Kaili. That was very informative and very good. Well done. So if anybody has any questions for Kaili about ALS, we have the chat bar that you can ask your question to. So we'll just give it a few moments to see if anybody has any questions.
Yeah.
And if anybody thinks of a question afterwards, you could always email it to me and I can get the answer from Kaili. I'll put my email in the chat bar.
Awesome.
Okay. Well, that was a very good presentation. You did very well.
Thank you. Thank you very
Thank you
much.
so much for that.
Thank you. I hope everyone has a great day.
Yes, you too. So have a good day, everyone. And we shall see you guys again.